Hello. Nursing theories guide us in our clinical practice in several ways, and all important ways, may I add. They aid in the understanding of their function and purpose in the healthcare context. It directs growth of knowledge, educates research, and practice, and are all directed by these nursing theories that have evidence to back them, evidence-based practices, if you will. Recognizes what should be the cornerstone of practice by stating nursing, but it recognizes what should be the cornerstone of practice, serving as a rationale or scientific basis for nursing interventions, and provides nurses with the knowledge and foundation necessary to act and respond effectively in nursing care scenarios. It lays the groundwork for nursing practice as well, indicates future path for nursing development, assists patients, managers, and other healthcare professionals in recognizing and comprehending the distinctive contribution nurses make in healthcare services. These theories also help in preparing nurses to think on nursing assumptions and help nurses explore values, further defining nursing and expand their knowledge about nursing as a whole. And it also gives nurses a sense of identity as well. So I do believe nursing theory makes a difference in care. I think it is important that we lean on the people who are before us. In a sense, we are standing on their shoulders when we use these theories, because we're always using them and always proving them, disproving them. The impact of theory-guided therapies on patients with chronic acute cardiac and psychiatric disorders, quality of life, self-efficacy, self-care, and stress was studied. Yunus et al. These 3 studies were rated to having high quality, 25 as having moderate quality, and 7 as having low quality. Nursing theory-guided therapies were shown to be beneficial in all of the highly rated trials. Yunus et al. Overall, nursing-guided treatments improved all of the outcomes investigated in the 26 trials, and at least one outcome in 9. None of these studies were reported that nursing theory-guided interventions were not useful. Yunus et al. Nursing theories have guided practice, and theory-led practice has proven to be more beneficial than traditional nursing practice. Yunus et al. Nurses should continue to guide their nursing practice through the lens of nursing theories and evaluate the efficacy of nursing-guided theory practice. It is a system that we use and we should be using in order to make a difference in care. Otherwise, things will become disorganized. So, I would know as a nurse if a nurse was using a theory to support working with a patient, because it's you would see evidence of a certain theory and practice being used. To be honest, a lot of nurses use nursing theory all the time, and usually you can pinpoint which theory they use. A lot of them use Orum's theory of self-care and the self-care deficit theory when assessing older patients and the external parts that affect their self-care, some of which is pharmacology, reading the labels, accessing these drugs, etc. And some are part of their psychology. Many times nurses do practice based on Erikson's theory as well, and definitely put everything in the context of what stage of life they are in, and according to Erikson, Ohio University. What would you notice if a nurse was not using a theory to support with a patient? I'd probably notice actions that are not aligned with nursing theory. And perhaps patients would give reactions that are not aligned with the outcomes that are evidenced in the theory itself. It would be a bit obvious if a nurse were saying things that went against our training, because everything in our training is evidence-based, and therefore, if I were to hear such things, I would know. How could the theory in a clinical setting impact nursing quality, safety indicators, and patient outcomes? They give us a core understanding of care principles, allowing individuals in the field to explain what they do for patients and why they do it. It is especially essential since it enables nurses to explain evidence that supports the techniques in the underlying practice. Thank you very much.